everyone. Happy New Year. Sanuper here. And today I'm super looking forward to talking to Drew Woodley and Katie Armstrong. Katie is the Director of Children and Youth Services at Epilepsy Toronto, and Drew is the Head of Governmental Relations at Epilepsy Ontario. Both of them are looking a lot into how we can increase access to epilepsy treatment for patients and how we can improve the patient experience. I've actually been thinking a lot about this area ever since a lot of these advancements with the COVID vaccine have been announced. It's made me realize how all these advancements in healthcare, no matter what disease you're talking about, are super exciting. But it's not just about the advancements, it's about increasing access to them and thinking about it from the patient's perspectives, concerns they might have, all of that. And even once this virus is gone, there's going to be so many other healthcare issues that have existed for so long that we have to tackle. So I think this is a really important conversation to have now, especially that healthcare is in the public psyche. So yeah, super excited to take a dive into this really new and interesting world. Let's get into it. All right, so it's super great to have both of you here. I'm really excited to learn more from both of you about how Epilepsy Toronto and Ontario work. But just to start it off, since it would be great to hear from your perspective, would you like to elaborate on what Epilepsy Ontario and Toronto's roles are in terms of improving access to social services and increasing advocacy for epilepsy?
Sure, so I can begin. So Epilepsy Toronto is a community-based organization that supports individuals with epilepsy and their support networks, and is one of the many chapters that are a part of the larger Canadian Epilepsy Alliance. So our services are client-driven for the Toronto area and include counseling, support groups, peer mentorship, information sessions and workshops, employment services, advocacy, and so much more. But every client's service plan is individualized to the needs and the goals for service. So we are always listening to the needs of our clients in terms of how we can support access to care and improve services and advocate for the needs of our clients.
Awesome, sounds good. And Drew, I know you're working more on the governmental relations side on Epilepsy Ontario. Would you like to elaborate a bit more on how that whole process works as well?
Sure. Epilepsy Ontario works with the 14 community epilepsy agencies across the province, like Epilepsy Toronto. We do a number of things. First off, for the parts of the province that don't have a local agency serving them, we try to provide some level of service to those communities, similar to what the local agencies do. Second, we also develop a lot of resources that community epilepsy agencies use in their day-to-day operations, education materials, and that sort of thing. And my focus is around government relations, which often involves advocacy on issues that are affecting not just one client or one part of the province, but are common across Ontario, but also advocating for additional funding and resources to expand the scope of what community epilepsy agencies can deliver in terms of programming and extend resources to the parts of the province that really don't have a local agency providing direct service like Toronto does.
Yeah, it makes sense. And speaking of looking at epilepsy treatment and access to services from that more systems-based perspective at the larger scale, like Epilepsy Ontario does, I was curious about what are some of the largest barriers that you see in your role when it comes to increasing access to epilepsy services? And what are some of the biggest things that you think we need to change about our approach?
Sure. The single biggest issue that we face is resources, and that often comes down to money and access to support in the community. That agencies like Epilepsy Toronto do fantastic work, but they also have to do a lot of work fundraising to have the money to deliver those programs. That's a big component of what their day-to-day reality is, because even though we're all registered charities, we've never been formally incorporated into the healthcare system in Ontario. So that's a big barrier for us, and a big part of what I work on is trying to make that formal linkage with the Ministry of Health so that we have sustainable funding to provide those resources and expand the number of agencies in Ontario that can provide services, even out the number of services that agencies can provide, because larger agencies are often more able to provide more services than agencies in smaller communities, and make sure that we're extending into the parts of the province that don't have the direct service that a local agency provides. So that's the primary barrier. It's the resources to allow us to do the work.
Yeah, for sure. Even when I've talked a bit about looking at epilepsy from the innovation lens, it's kind of a similar issue of resource. So you definitely see that um, in a lot of different areas of epilepsy treatment and helping epilepsy patients. Speaking of some of the pain points and the barriers to increasing access to treatment, I also wanted to look at it a bit from the patient lens, since that's a side of the story that's really important to hear. So, Katie, if you'd like to talk a bit more about what are some of the biggest pain points that individual patients often experience when it comes to getting access to social services and epilepsy treatment, just from your own experience. Do you have any insights on that?
For sure. So this area can be extremely challenging for patients. So firstly, a patient may not be aware of what treatments they may be eligible for, or not feel like they have enough information about a specific treatment in general before deciding what to access. So prioritizing psychoeducation for the family and the individual is key. So they know what they're eligible for. They know what treatments are available and what services they can access. As well, financial barriers can influence what treatment families can essentially access. So examples could be medication costs for families who don't have private insurance or medication coverage for a specific drug, or if the family wanted to go forward with, say, medical cannabis. Well, medical cannabis is not covered, so that can be quite expensive for families who may not be able to afford it, and there's very limited funding support for that. Also, if a family wanted, say, a seizure monitor to help increase the child's safety and reduce injury or even death, but because of the high costs associated with the limited amount of seizure detectors that there are, may not have access to that. So another example just occurred recently. I can share a bit of a story where there's a family that we're currently working with, and they've been trying to obtain a further diagnosis for their child who has drug-resistant epilepsy. And this has been going on for a number of years, but the child was recently diagnosed with an extremely rare genetic disorder. And the parents have researched this, and they found some very specific gene therapy treatments that are actually on the horizon. However, their main fear is that once those treatments are developed and available for Canadian patients, they won't have access to them due to the extremely high costs associated with them. So again, the financial barriers that individuals and families face for treatment are incredibly impactful for their journey. But as well, wait times for supportive testing in EEGs and MRIs, the lack of access to epilepsy monitoring beds in some of the catchment areas, neurology consults, they can be 6 months to a year. So wait times are extremely challenging for families and frustrating, and only increase the worry that they have if if they don't know kind of what treatments they're eligible for, because they can't even make that first step for a consult or for a supportive test.
Yeah, for sure. And just to follow up to that, I know you mentioned a lot of different innovations like seizure monitors and even medical cannabis, which in some cases can be fairly new to the space of epilepsy. There's innovation happening all the time. I think both of you might be able to speak to this, but what else? Do you have any other insights or thoughts on the integration of these new technologies to help the patient experience, and any other barriers having to do specifically with implementing new technologies into the space of epilepsy management?
Well, one of the things that the medical practitioners started realizing several years ago was that the technology that allows for surgery for some people living with epilepsy, depending on the kind of epilepsy they have and where the foci in the brain is, the surgery, the technology to do it is there. But they were running into the situation where a lot of medical practitioners weren't referring potential surgery candidates to the surgery stream. That there was a knowledge barrier there, even amongst physicians, where the typical course of treatment would be medication, and even if those medications weren't working, medications would get added on and added on, rather than starting to move them to the surgery stream. And so they did a lot of work to actually build up the surgery capacity in Ontario, because the technical innovations were there. It's getting patients looked at and getting patients considered for surgery to see if they would be eligible to do that. On the psychosocial side, a lot of progress in the last few years, I think, has been made around including things beyond the seizures themselves, the seizure management themselves, as part of the scope of care. So a lot of what community epilepsy agencies have started doing is work around mental health issues for people living with epilepsy, because rates of depression, anxiety are much higher. And there's actually been some good programming developed even here in Ontario for how to do that effectively, most effectively, with people with epilepsy. That group depression programs have been developed here that are starting to be rolled out. So there's been actually a lot of innovation on the research side on that as well.
Yeah.
And the research side is huge for us. I just want to add, because it really tells us what can work effectively with each individual, each family. Again, every individual story is so different and unique, but the research projects are really developing the key programs that we can deliver within each epilepsy agency.
Yeah, and Drew brought up a really interesting point about mental health and how there is a mental health crisis going on for the general public. There's so many people who suffer from depression and anxiety, but when you have a disease like epilepsy, that can often be amplified, and it's even more of an issue. So building off of that, I know, Katie, you probably encounter this a lot, but how do you go about understanding the experience of a patient with epilepsy? Because it can be difficult to empathize with a patient if you don't actually have the disease. But whether any of the viewers watching have people in their lives who have a condition similar to epilepsy, or whether they just want to learn more about what it's like to live with this disease, what are some things that you do in your role in order to help empathize with patients more and to understand their experience?
Well, firstly, I would encourage others who don't have prior knowledge on epilepsy to become educated, to learn and gain that knowledge about epilepsy, the barriers that they might experience, that psychosocial impact that epilepsy can have on an individual or family unit as well, because it's not just the individual, it really can impact siblings, parents, spouses, etc. So knowledge is power, and being informed can really help to reduce that stigma and can create more safer and inclusive environments for individuals with epilepsy, and can also help to show support for those living with seizures and epilepsy just in general. So this includes providing psychoeducation to those living with epilepsy as well, to improve their own health literacy in order to communicate information pertaining to their own health and improving their own outcomes as well. So Epilepsy Toronto and all the individual chapters have great resources and information on their website, have events throughout the years to continue that public education and opportunities for everyone to continue learning through education series and workshops, conferences, and just more opportunities to become connected. It's also incredibly important, in my opinion, to recognize that everybody's experience with epilepsy is individual. So asking the individual or the family you're working with how you can help better support them. What are those barriers that they're experiencing or facing, and what supports that they think that they need to also help them. So at Epilepsy Toronto, we listen to the information that our clients are giving to really help shape the services that we're providing, right? So if we hear that we have a number of clients requesting a parent support group, well, then we provide a parent support group specifically for parents of young children with epilepsy. It could be the same with individuals who have epilepsy and are new moms. So we look at how many of those clients that we have, and we create opportunities for them to connect, because they have similar goals, possibly they have similar questions about what it's like to have epilepsy and also to be a new mom and go through pregnancy as a female. So we're really listening to the questions and the need for service from our clients to really help shape the programs that we essentially provide. But a lot also from the actual patient can be done through individual counseling to really work through that psychosocial component of epilepsy, because everyone's issues are unique, right? So hearing what they're facing and really creating an action plan tailored towards their unique case.
Yeah, I think it's really interesting how the medical field in general is moving towards this more personalized approach, and to see it on the counseling side where in some ways it's been happening like that for a while, but seeing that you're focusing on the personalized medicine kind of side is really interesting. Um, yeah, and looking at it from, or going back to that systems perspective again, Drew, is there anything you would add for how we can improve systems to tackle mental health specifically for patients with other conditions like epilepsy, or anything to add on to what Katie said?
I don't have actually that much to add on to what Katie said. They do a fantastic job at Epilepsy Toronto and the agencies across the province in terms of delivering those individualized programs. The challenge for someone in my position is taking it to the policymakers and saying, this is why individualized programs are important. This is why we need epilepsy specific mental health programs in Ontario, and we need the resources to be able to deliver them. We need to be able to have a sit down conversation with somebody who's been newly diagnosed with epilepsy and their families, more than 5 minutes at the doctor's office, but actually have a longer conversation with them to tell them about what they need to understand in terms of adjusting to and managing epilepsy, but also to take in their questions and their concerns. And every family, every individual is going to have different concerns that need to be addressed. So we need to take the time to do that properly, but we need the resources to do that.
Yeah, for sure. And kind of taking this more towards the perspective of advocacy. I know we've been mentioning that word a few times here, and a lot of the times people might tie the word advocacy to awareness. And I think it's great that there's a lot more awareness happening with epilepsy specifically, and many other diseases, especially diseases related to mental health. But I think advocacy can look like a lot of different things. And I also think it's one of the areas where people listening who might not have a PhD in epilepsy or neuroscience might still be able to help make an impact. So I was curious about both of your views on, I guess, what advocacy means to Epilepsy Ontario and Toronto, and specific action items that you might have for someone who wants to help make an impact within the space through advocacy.
Sure. So I can begin, and then Drew can follow. So at Epilepsy Toronto, advocacy is typically client driven. So but that can also go into a much larger advocacy case as well. So typically we're contacted by clients, or it will come up in client sessions where they will share that a barrier or restriction that they've experienced in accessing support, service, or care, and where they have faced that discrimination because of their epilepsy. So for example, as I work mainly in the children and youth department, one environment where advocacy is extremely needed very regularly with my clients, both on an individual basis, I would say, but also as a whole, is within the school system. So I may have a parent of a child with epilepsy share that their child's teacher feels unequipped with information to support their child's seizures within the classroom, or a family will share that their child's school is refusing to administer rescue medication, or that the child was restricted in activity or an event, or they weren't allowed on the bus route because they have seizures. So Epilepsy Toronto, but also those individual epilepsy chapters, they would be able to assist that family with navigation and mediation with the school, as well as provide school education for staff and students, and help develop those seizure protocols for the school. On a whole, though, epilepsy can advocate for the need to strengthen school board protocols as a whole, demonstrating that need for accessibility and training and inclusivity and equal education. So there are many kind of examples throughout the school board that I could give you, but I think what I've kind of said gives enough at this point. But so as an individual, we focus with the patient or with the client, and then as a whole, we would join together with Epilepsy Ontario to advocate how to make more systemic changes to the Ministry of Education, really, so that every school board is providing similar and equal support to students with epilepsy. So I hope that kind of makes sense.
Yeah, that's exactly it. That Epilepsy Ontario's role is to take those issues that individual families across the province are running into, barriers they're facing, and working with them, working with the individual epilepsy agencies who are hearing about it and bringing it to us to formulate a way to move forward. And that can be in terms of an advocacy campaign, can be reaching out to perhaps other disease charities that are running into similar issues with the school system and coordinating approach that way. It can be developing resources that local agencies can use, but it's about bringing together the large umbrella issue so that the local agencies um, are able to support the individual.
Mm-hmm. And something you mentioned was that a lot of the times, a lot of the change that happens is sparked because a specific family or patient had an issue, and that kind of prompted all this change to happen within the system. What I was curious about is whether there's also a shift happening towards, rather than trying to react to problems, trying to prevent them, whether there's
Mhm.
any systemic change happening in that lens as well. And if there's anything to add on that topic.
Yeah, we've started doing more of that work, that we're able to work in conjunction with the local agencies to start anticipating some of the issues that might be coming up. So, for instance, this year with students returning to school in September and changes to the school system around COVID, we were sort of starting to anticipate some of the issues that were potentially students were going to face. So we proactively started reaching out to the Ministry of Education about those issues. Other issues that people can be running into, where it's not simply just reacting to an individual case, but we know from experience other people are going to be running into a problem. Things like employment insurance and epilepsy, once you get into the working world, can be an episodic disability, which means you're not always going to be prevented from working because of it, but you will at some points. And the way our current employment insurance system is set up, that's a really difficult place for people to be in because it doesn't like having that gray area between being able to work and not being able to work. So one of the issues we've taken up in the last few years has been around better support for people who are living with episodic disabilities like epilepsy, so that they have a little bit more flexibility when they need support.
Yeah, definitely. I think accessibility within workplaces is definitely going to be super, super important in the next few years. So it's really interesting to hear how Epilepsy Toronto and Ontario are working on that. So I think we've talked a lot about all of the different problems or barriers to increasing access to epilepsy services, from access to funding to being able to understand patients at the individual level. There's all these different components. And we've learned a little bit about how the system currently works right now to get some perspective on that. But I think the part that could be really interesting is talking about the future and what's to come next, and how a lot of these barriers might be overcome, whether it's through different delivery models or different technologies. So I was curious about, both from the systemic lens and from the patient-based patient experience lens, and even like the policy governmental side, what do you think the future of epilepsy services will look like in the next 10 or 20 years, or even beyond?
One of the few good things I think that has come out of uh, dealing with COVID over the last year has been how quickly agencies have been able to move their in-person programs and services online, into sort of a remote delivery model. And that's really allowed us to say, wait a second, just because you live in Toronto doesn't necessarily mean the person who is providing support to you has to physically be in Toronto. Or if you live in North Bay, you don't necessarily need to have someone also in North Bay to deliver those services. And I think that's something that we are starting to innovate, where we're starting to see, if agency like Epilepsy Toronto has a little bit of capacity, extra capacity for a program, what's to prevent somebody from North Bay or Kingston or Sioux Lookout or Windsor from accessing that program if it's being delivered remotely. So I think that that's going to be an interesting innovation for us as a field over the next little while, because we have a lot more flexibility around how we deliver services and deliver them across geographic differences and areas.
I would definitely agree with that. And also just providing more options for patients in how they receive their care. So I know not too long ago, you were able to speak with Dr. Lewis through the Neurology Center of Toronto. And that's a new model that we've recently become involved in at Epilepsy Toronto, that virtual rapid access clinic. So it's really supporting patients during this time of COVID-19, but also has the availability to continue post COVID-19. And it's really helping to reduce those wait times to see a neurologist, but also kind of have that walk-in style model where you're receiving rapid access to care and to a wealth of professionals who can really support you or your child with their epilepsy diagnosis and treatment. So we're a part of that in the sense that we want to make sure that patients are connected within their community once they leave that virtual appointment as well. So to make sure that their mental health is supported, to make sure that psychoeducation is supported as well and provided, and that they're connected within their community. So like Drew said, it doesn't really matter where you're based in Ontario. With COVID-19, it's developed this virtual world where clients can have more access to support and services, but it brings in also the issue of where there's families who don't have the accessibility in terms of internet or even strong internet. You know, a lot of catchment areas may not have that internet strength for virtual care, or they may not have a computer, or they may not have Wi-Fi, whatever it is. And so hearing those needs as well and looking for more funding opportunities to really support families or other models of care to make sure that we're delivering those services as efficiently as we can as well. But I think with COVID-19, it's really opened our eyes to a lot more access to services out there for clients.
And more flexibility in how they're delivered, right? That if there were, say, two people in Toronto who would maybe want to make use of a new parents support group, which maybe isn't quite enough to run the group, but you open that up to the entire province, you might have the 6 or 8 people to have that critical mass for a group where you wouldn't before.
Yeah. And I would agree. So at Epilepsy Toronto, we have employment counselors, and many of the other agencies don't provide those supports. But now that a lot of our services are virtual, that does open the door, you know, as well as just workshops that we can be putting out online that are really tailored towards kind of bigger topics, and making sure that they're arriving to more clients out there that may not be within our specific catchment area.
Yeah, it's really interesting to see how a lot of the times before COVID, people would talk about how telemedicine and virtual healthcare was going to be the next big thing. It was going to happen in the future. And it's really interesting to see it almost happen right in front of your eyes, whether it's with the medical side or even in other areas of life, like education, for example. Just to elaborate a bit on the systemic change or what's going to happen in the future. You might have touched on this a little bit, Drew, but do you think there's anything that's going to change or that should change about how discussions with policymakers currently happen around increasing access to epilepsy services?
Sure. So the biggest challenge we've been facing in terms of getting stable funding is the recognition of how much value programs that community epilepsy agencies provide benefit the healthcare system. That in terms of saving healthcare costs, in terms of providing mental health supports, in terms of reducing unnecessary hospital usage, those are the key metrics that we need to get across to policymakers, and have been starting to do so. The challenge for us is them willing to take that step and say, okay, yes, you haven't been part of the system before. Let's start bringing you in. that's where we need to go, where the discussion needs to go for us, is just formalizing a relationship, so that we're not always trying to demonstrate our value. It's a certain level of acceptance that what we do is important. Now let's figure out how to make it work, and make it work at a larger scale.
Yeah, totally. I can definitely see why getting policymakers on board to even make these decisions and implement them is so important, because you guys are doing such important work that's literally impacting so many lives, getting so many people access to healthcare. A lot of it is because of people like you guys. So it's been really awesome to have you guys on this interview. I've learned so much from you guys. But just before we head out, I wanted to ask if you have any parting words or pieces of wisdom for people listening, where for a lot of these people, it might be some of the first glimpses into this world that they're having.
I would just start by saying, share your stories. Be willing to share your stories with your local agency, share your stories with your elected officials, because I can provide all sorts of stats and data and that sort of thing. But the more faces there are to epilepsy, the more effective the information I provide will be.
I would 100% agree with that. We want individuals and families to start talking about it, or continue that dialogue, because we don't know what to provide. We don't know what to encourage. We don't know what to put in place unless we're hearing it from our clients. We have a good understanding, but at the same time, we want that client perspective to really shape the programs and the services that we continue providing. So I would encourage everyone to keep sharing their stories. I would also encourage everyone to continue learning and advocating for accessibility and treatments and support services, more stable support services too, for individuals and families living with epilepsy and rare diseases.
Awesome. Thank you so much. Take care, guys.
Thanks for having us.